Okay, so if you're just joining us live, I am talking with Dr. Adebanke Adebayo. She is an emergency room doctor in the New York area, and we're just talking about coronavirus, how it is facing coronavirus from the front lines. So as I wait for everybody to join us back and I wait for Ade to come back on, this is just for anybody who's joining us now and you missed the beginning. It would be posted to my story for 24 hours, and I also posted to Instagram, Janelle Jackman MD. Just waiting for Ade to come back on, okay? But we were talking about testing. Here we go. I think Instagram definitely needs to make this live longer. I'm realizing Instagram needs to make this live longer.
I feel like
But
those people that stay on longer, they're paying them because I see those DJs stay on for hours and hours. But I don't think us small timers are privileged to that
they just give us
information.
1 hour.
Yeah.
But yeah, my point that I was going to be making with the testing of coronavirus is the fact that as we learn, as time goes on, we learn more about it. People are doing studies, so we're learning more about it, but it's kind of difficult to have definite concrete answers at this time. So a few couple points I want to make is one, we always have to remember that with every test, and because this test had to be made so rapidly, there's a certain amount of false positive and false negative. And what that means is a false negative mean that there are going to be some people, and some people say as high as 30% in this test, but there are going to be some people who has coronavirus and they're going to get a negative test. But they still may have coronavirus, they still may be infectious, but the test is just going to tell us that it's negative. A false positive, on the other hand, is there are going to be some people who are negative. They don't really have coronavirus. They may have had the common flu or some other virus. And because it's similar in the protein, it may react to the test and tell you that you're positive. So the numbers aren't always 100% definite because the sensitivity and specificity that tells us the false numbers. For this test, we're kind of figuring it out on the go. This test is not a test that we've been creating for years and had time to dole it out and test it out. It's right now. It's happening live. So that's something to take into consideration. And next thing is that we're really not 100% sure about if it's possible to be reinfected or not. With the common cold and the flu, you are able to get it more than once. Okay, immunity for that lasts about 6 months, sometimes up to about a year. But so you are able to get it. How long would the antibodies last? We're really not sure. So having antibodies usually help you to fight a disease because your body is able to figure it out and recognize it much quicker. But how effective is this for coronavirus? We will just have to, unfortunately, wait and see. And the third point is that a lot of viruses tend to mutate. So whatever your body was identifying it with, let's just say, for a simple example, let's say that your body was recognizing the virus by the hair. It's like, oh, this virus has black hair. I'm going to easily identify. Then virus mutates. And what that means is that the virus will now change its hair to blonde. So the body can recognize black hair, but now the virus is blonde. So the body was like, oh, you're new. I don't know you. Come on in. Let's welcome you. So these are things that you just have to know going forward, which is why, taking precautions every step of the way. And I think we're going to be taking precautions well into reopening of states. I don't think as the states decide to become open that you should be the first one rushing out without a mask, with no precautions, hugging, kissing. I think you still need to practice social distancing even when we start to reopen, even when we start to go back out to our workplaces. I think we still need to kind of take the lessons of Corona with us going forward until we really have some sort of understanding with it. So that was just like my little points on that. Let me see if there were any questions that I missed.
I think we missed
Some people mentioned, oh, the test is not always necessarily done correctly. That is true as well. You can miss, if you don't do the test accurately, if you don't really put the swab deep enough, you may miss the virus and you may have an inaccurate test.
I mean,
What do you
a
think?
good way is putting sometimes saline into their nares. So it like swishes around and that will help. Like a dry swab versus one that's wet is a little bit better.
Right. So someone's asking, what do you think about the throat swabs for COVID? I mean, some places I know they're doing a throat only swab as opposed to a nasopharyngeal. So nasopharyngeal is when they see them go through your nostril and they push the swab like way back, so it kind of like touches the top of your throat. Versus a throat swab, they go through your mouth only and catch the get the swab from the throat. So what is your opinion on that?
So that's a couple of things that it's multifactorial. It depends on the medium that they have at the time, right? So it's not about like, I think what happened initially is what we had available is how we tested, right? So I would walk into work and they tell you today is nasopharyngeal swabs. You're going to do it this way. And then you come in, right? They'll get 100 of one kit, and then you come in another day and then there's 100 of a different kit that's tested
Okay.
a different way. It also mattered what vendor they were using, if they were going to be tested. Some were going to DOH. DOH became inundated with the amount of tests that they had. So the next step was to go to, you know, like a private company as like Quest or whatever. So it all depended. Is one, from what I know, the nasopharyngeal is a little bit more sensitive than the oral pharyngeal swab, but you have to think about it. Something's not available and it is available, right? And then you get tests. You say, no, the nasopharyngeal works much better and they don't have it. Then you forfeit being tested, right? So now you really don't know. So that's significant in the testing.
How do you, no, sorry. Does your hospital have a certain protocol to follow when you're low on ventilators and you have to choose who to give it to?
Ooh wee. Who's that asked that question?
That's actually my sister.
That part is so sensitive, you know.
Right.
It's like hard, right? So you can save. No one ever as a physician wants to be in that predicament. I can save 2 people. I can save 1 person between 2 because I only have equipment for 1. How do I choose? It's hard. You know, that information is something that is beyond myself. Sometimes it comes from like the chief medical officers, but you know, you just hope that you have really, really strong leadership. A lot of times when we were faced something close to that, we'd find out that the older person was a DNI. Like they specifically said, please do not put me on a ventilator. Those were their express wishes. So I didn't really have to, but the times that you do, you know, you have to think about, you know, not whose life is more important, more so that you would have to think about who has the better, like quality, who has a chance of beating this a little bit more. Right. So the person who had a stroke, who has diabetes, who's hypertensive, versus this person is 40 years old, never smoked, never drank, is a marathon runner, healthy person. It's hard, right? It's the most, like, probably one of the hardest things that we had to do during this pandemic. You know, you think about who, you know, you have 3 doctors, but when you're resuscitating a patient, all of you have to work together. But now it became to a point where, you know, you're kind of splitting. So you can't, because there's so many patients and you can't really get everything you need. And so it became a battle. And it's hard, you know, to tell somebody that, like, I know you need a ventilator. And fortunately, we didn't have that issue a lot. But there are hospitals that did, you know, that got hit and struck, like hospitals in Queens that got struck so hard. And luckily, the governor heard their cry and started, and, like, you know, they had private donors donate. But it's just, picking is hard. Like, I don't know. It's just not. And
I just want to say is that I want to let people know that in the healthcare professional, no one is coming to work with the intention of not saving a life. And not doing the best that you can for every single individual. We don't come with the intention to pick and choose between, anyone, So our intention when we come to work, I'm not an emergency room doctor, but it's the same thing with with obstetrics. You come expecting to get a baby and a mom. You don't ever want to be in a predicament to choose which one am I going to choose today or which patient. So it's the same thing. Just Corona made that objective a bit harder to accomplish at all times. And I'm kind of taking over the response just because it's an uncomfortable thing I know for you to respond to, and I don't want to put you in any uncomfortable scenario, especially that you still work in a hospital system. So just know that the intention always from all medical doctors, all medical staff, the nurses, the doctors, the CNAs, the medical assistants, is that our goal is to try and help and save every single body. Our goal is never to pick and choose. Sometimes in life we are presented with difficult circumstances like a pandemic where we were not prepared, where I guess never even imagined how to be prepared for it, and you came down to a choice sometimes. But as much as possible, we try to take a lot of different things into consideration before making that choice. And it's not an easy choice. No one goes home feeling proud that, I chose A over B or B over C. So it's definitely that it's not the case. And I know that I've heard some things about like people saying, oh, in the hospitals, they're just killing people and they're purposely killing people. And that is very disheartening as a healthcare worker. I'm not even working in the emergency room, but even hearing that is very disheartening to hear, because no one studies for years and years and years, have tons of medical debt, tons of medical school loans to go to work and say, let me see who could I harm today. That's not what we do. So I just want people to know that definitely everyone working in this time is doing the best that they can for everyone. And we do see a disparity in certain communities, unfortunately, more affected. And there are different reasons why different communities are affected. Late presentation, unfortunately, there's a health disparity in the system already. So it just gets worse with coronavirus. And it's misinformation. We initially thought, a lot of people thought, oh, we wouldn't be affected, Look at Africa. Africa has no cases. Look at the Caribbean. The Caribbean had no cases. So a lot of people thought that they were somewhat immune to it and didn't really take precautions. And then a lot of comorbidities add to that. So it's not that healthcare workers, at least I can speak for myself and Ade, it's not like, healthcare workers come to work with this intention, okay? So that's the best that we can answer that question.
No. There's like a video. There's two videos circulating. One is an NP, and the other one, I think she says she's a nurse. About we're killing people, and it's just like, what? Like, a lot of because things don't like, the odds are against us. We're not killing anyone. People are dying. We're not killing it. You don't have enough equipment. That comes from, it's more than a hospital thing. It's like a state thing. It's a federal thing. And so they are the ones that have to supply us with the things when we go through natural disasters. Right. So, when you see those videos and you're just like, I literally come home and I'm like so bummed out, so anxious. I don't sleep more than 3 to 4 hours a night because I'm so anxious about everything. And then to hear, oh, we're killing patients, it's just like, it's such an insult. Like, it's such a like, what? Like, are you crazy? But whatever.
Someone close to me actually had made that statement. Not that they themselves thought of it, but they referenced the video and was like, oh, listen to this video. Look at what they're saying. This is true. And I was like, anyone can take a camera and make a video. Doesn't make it true first and foremost. And then another thing you have to remember is perception. Perception is a big thing. So to a relative of someone who has suffered with corona and unfortunately passed with corona, they're very emotional. And from their perspective, I do understand they would see the worst in the system at this time, and they would only see it through their eyes. And I understand that, and I empathize and sympathize with them. But trust me, no one is purposely coming to. Remember that healthcare professionals working in hospitals right now, every single healthcare professional that goes to any hospital right now is doing so, risking their own life and their own family members. We're not doing that for fun. The compensation is I'm telling you, and I'm not trying to be conceited, it's not that great to risk your life. So
Okay.
anyone's going to work today, even beyond healthcare workers, the grocers, the pharmacists, scientists, police officers, MTA workers, they're all doing it at a risk to themselves and to their family. And it's much better to be in a position where you're like, okay, whatever, I'm just going to stay at home and be safe. You're much safer at home. So I think, like, acknowledging the fact that, when you come to work, it's to work and it's to do your best. It's very important, and not to spread these false rumors or misinformation and emotions that people may have. It's definitely not true. Okay. Um, so let me see what else, if we have any other questions. Especially with a new disease, it's hard to know for sure what will make people better. Sometimes you get desperate and try anything to make someone better. Intubation, hydroxychloroquine. This is a very good point that Dr. Bynum is
Mm-hmm.
making. So that's one thing people have to remember too. This coronavirus is new for everyone. And I sort of touched on it earlier, the fact that, you saw guidelines changing weekly, daily, monthly. And it's because as we learn something better, we do, as you know better, you do better. So we initially thought hydroxychloroquine was going to be the savior, and it hasn't been. It's not. We thought that the vents were going to help, and we realized that certain settings are more detrimental than others. So we evolve with the knowledge that we get and trust that, unfortunately, if something that we did before didn't work, we're not going to try to continue it for months on end. We're evolving with the information. So
That
that is like a big fact.
that hydrochlor the hydrochloroquinone, hydroxychloroquine,
Hydroxychloroquine, yeah.
or plaquenil. It became one of those things because the leader of the United States said, "Oh, use the drug," and then so everyone wanted it, and it actually had like a 20% mortality rate, right? So those are the things that we had to face. Someone above us is telling us to use, although not medically trained, but
Right,
no one contradicted his statement, and so it became part of the standard of care. By the time like things trickled down from like Washington to like Albany to us, you know, that's a difference of sometimes a week. Like in the era of COVID, it's been a little bit faster, but sometimes it's like a week or two. So we're already behind on
right,
treatment. So, there's so many factors that play into this. And it's just one of those things that you just really have to think you didn't have control over it, but
right,
you do whatever. Studies came out, you try the studies, you read the studies, you hope it worked. But it's kind of like when you're like someone's having a heart attack, or someone's at near death. We have algorithms that we follow, but sometimes you go out of the box because you're like, if I don't do it something, the person's going to die.
right,
And so it's just one of those things where we started doing just as we changed medications as it went, um as it progressed actually, but not everything worked correctly.
right. So taking a little slight turn in the conversation, it's a little heavier, unfortunately. Yeah, is, being in New York, I mean, I know I have, so clearly you have been, because I worked at that hospital as well before. Um, it's not being mentioned as much, but there are a lot of healthcare workers dying from coronavirus on the line of duty, trying to help and save others. And this is my point that I was trying to make earlier with the fact that we're not going to work for fun. We're actually being affected. And there are tons of healthcare workers, ranging from transporters to, the cafeteria workers to medical doctors, nurses, um, patient greeters that are getting coronavirus while at work and subsequently, unfortunately, dying. And we're not hearing about this so much. I know the New York Times actually covered it in an article, and they actually referenced some people that I do know who passed away, unfortunately. But how do you think the response was to the passing of various staff members?
I mean, they're like your family, right?
Right.
So you have a family member that went, and it hits harder, I think, more than anything else, because one, you feel like that could have easily been me,
Right.
like, how God spared me, but unfortunately let that person succumb to this disease. And so it hurts because you feel like is there something I could have probably done to save that person or help that person? And it just becomes a weight on you. The people that we've lost, you know, God rest their soul. It's just one of those things. They sacrificed for the better of people, but at the same time put themselves at risk. And
Mm.
now, you know, they're suffering with corona-like symptoms, and it's just, it's heart, it's like gut wrenching.
Yeah.
Like, somebody I just saw and I knew that they fought for my team is no longer here, and I'll never see them again. I would never be able to adapt to that. I would never be able to have like no feelings about that. It's
Right.
super, super sad.
I know from the workers, there is definitely a response to try and honor and recognize staff members. But in terms of administration, do you think that these workers are getting enough recognition for what they did
Well,
to
that's
help?
all. No, I think that's all dependent on who your administrators are. Um,
Right.
Initially, obviously, when someone passes away, they have their system, but this is a little bit different, and it's a little different. It's a different time frame. You know, it's just so multifactorial. But for the most part, I think that it is super important for people to grieve the way that they need to. But,
Right.
you know, they give like those little packages. Some people give baskets or cookies. That's never going to take away from the pain that your family is probably experiencing. The other thing is, like, again, when I said like a hero's nothing but a sandwich, you know, you risked your life, and now, you know, they're not giving your family your salary for the rest of the year. You didn't work it.
Right.
You know, they may give you $100 gift card or a $50 bouquet of flowers, or yours. Here's our sincere sympathy, you know, and what does that do for your
What does it
family?
do? Right.
I don't know.
You know what the process is in terms of burials or so for patients who passed from corona?
So burials are very different. Initially, funeral homes didn't want to take anybody, and then it became cremate them all, right?
Mm.
Like, how many bodies can you cremate? And
Right.
for some people, that's against their religion. So they started taking bodies, and like I've heard, like I remember someone passed away that I knew in April, and they were saying like the next available date was May 15th, and I was like, wait, what? And you know, cremations take longer than they're supposed to, because they really have a hard time keeping up with the volume.
I know.
Yeah, they never see this. Who sees this? Last time we had close to this level of volume with sick patients, I think was it with the plague or the flu pandemic in 1918, I want to say.
Half of us probably
That's,
weren't born.
I know I wasn't. Um, so, you know, we don't know. We don't know truly what they did, you know, but it's hard because traditionally from our cultures, right, homegoing is a big thing,
Right.
and you rob them of that homegoing. So it's like, does their, you know, spirit really get to rest in peace? Because you didn't really send them away the way that they're supposed
Right.
to. I don't know.
I know it's such a difficult time for everyone, and definitely it reiterates that therapy and different forms of emotional outlet would be needed to be able to cope during this time and probably for months and years to come after this time, if we have an after this time. Hopefully, if we do, that comes sooner than later.
Right.
Uh, Another question that I had, also another sort of touchy question, is that I also read an article, I think it was from the Insider, that stated that many CEOs of hospital system makes well over a million and more. And a million is like really low. Most of them make into the millions of dollars per year. And most of them actually maintained their salaries throughout Corona. Some of them even got their bonuses in April. However, their response to the loss, the revenue loss from the hospital was to either fire people cut their work hours, cut their salaries. They resorted to furlough, which I absolutely hate that term because it's like a limbo area for the employee. They force people to take paid time off. They force people to take non-paid time off, non-paid time off. They force people to take their vacation. So, I mean, what do you have to like say? What is your response to like a CEO who is making a million and more, but yet telling you who are making well less than, I mean, I don't want to say, but you know, you're making definitely well less than 100,000, even less than that. And they're telling you, oh no, you just have to take a pay cut while I maintain my $1 million, two, three, $4 million. Hmm?
So I think I was telling you, I read an article, it was separate from the Insider, and they posted the salaries of like the giant insurance companies of the world
Right.
and also America. And one of the CEOs had made $66.7 million for the year,
Well,
and another one made 30.1. And so, you know, I quickly do the math, and it's just really like underneath this meme, it tells you for how long. And come to find out that these people are making $90,000 a day, $120,000 a day, which is more than most people's regular salary. And it's just, I don't know, like, how do you expect people to survive? You know, how do you expect people to want to come into work while you sit and you're not
at
really in the
home.
trenches with, yeah, you're not in the trenches. And then when we talk about hazard pay, it's like, no, but then, you know, they love to throw this thing in physician faces and say you took an oath. You took an oath to save people. You didn't take an oath to go in front of a firing squad without any vest, or go in front of a
Right.
firing squad. Like, that wasn't a part of why you were trained. And so when they see them spend all this money, and I think it's not fair, you know, like, when is someone going to say, you know what, that is wrong? Like, that, even their bonus checks could have helped probably half the population. So I don't know.
That is true. And we took an oath, yes, for medicine, but what oath did they take to get as much money from us while we do the
Right,
work as well? You know,
right.
it's very difficult for me to hear like all these things and read it because even though, you know, I'm not currently working in a hospital, I work in a center, like a clinic, but it's still disheartening because I see my colleagues going to work, doing their best, suffering, dying,
Mm-hmm.
losing their loved ones. I can't even imagine what it will be to, as you said, literally, you saw someone today, you see them get intubated tomorrow, and then you can't even really tell them goodbye the following day. So you're going through all this emotional, and the only thing that they throw in your face is like, "Oh, well, you took an oath." Um,
Or pizza.
yeah, because pizza cures everything, right?
Yeah, you didn't know that?
Yeah. And so I know that you mentioned hazard pay. So you're not getting hazard pay even though you're on the line of duty every day.
No.
Wow. So I know like the misconception, that's what I try to tell people, the misconception that people have with like many of the doctors that, you know, oh, doctors makes millions and millions. No, 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 no. The CEOs makes millions. The doctors, you know, get what's left that we shell out through all other members of the hospital staff. So we actually don't run the hospital. We actually, you know, we're just like another player in the whole game. But it's really disheartening that, you know, this is not even a talk for consideration in most places, that they're not even considering that the risk that you're putting yourself in daily should warrant some amount of compensation. And no amount of compensation could actually really make up for what you're going through, but it's just in good nature to do it anyway. Um,
I
but
mean,
yeah, I can't.
it comes down to a couple of things, right? So I think we had this conversation. So physicians used to run facilities, and a lot of the
Right,
physicians that ran the facilities, they ran bankrupt. Not because they were the ones that mismanaged funds, but then it ran because people weren't trained how to run hospitals financially.
right,
So doctors were fiscally irresponsible, and so hospitals closed, right? So it
right,
became that the person who had the MBA or had a business degree was the one who would control the money in the hospital. And that's a good
Right.
thing, but so that balance is necessary, right? Because this person knows dollars and cents, but
Good.
I
Yeah.
know humans and what they need. And so you need somebody that can give it a nice little mix, because we can't afford to lose any more hospitals, but we also can't afford to lose healthcare workers, right? So
Exactly.
when I'm taking care of someone, I'm like, this person needs this medication. I'm not thinking, you know, when I write my scripts, I might think, is this too expensive? They may not be able to afford that, but I don't write like drugs just because they're in trend, you know, like I make sure my patients are economically on the same page. And CEOs like getting bonuses, you know, I say it, I don't, if you work hard, you get your bonus, but that should not be in replacement of you get your bonus and then I tell you you're furloughed. Like, no,
Right.
no. Like, if you truly believe in teamwork, then that shouldn't be the case. And that's pretty much how I stand on that, you know. We like I told you I don't want hazard pay. I want them to take care of my loans. You know, take care of my loans and I'm good, you know. Like we're good. But hazard pay is all relative. How much are they gonna give you for hazard pay, you know? Was it like, when is money ever enough to run in the middle of a war without enough equipment? You
Right.
know, I agree. People do see you and say you're making all this money. Like, I saw someone in a hospital and they're like, oh, you're a doctor and you're making all this money. I'm like, am I? Like, what money am I making, sweetheart? Like, please enlighten me. So,
In the center where I work, I can tell you for a fact, most of my patients make way more than I do.
well, not
Most of
mine,
them.
actually. Not mine.
Sorry?
You know, I
Well,
pay
yeah,
your
we work in
salary.
different areas.
I pay your salary. Okay, sir. What would you like for me to do today?
Yep. Did you actually see like an increase of like volunteers at the hospital? I know that a ton of volunteers came to New York to help with the crisis. Did those volunteers trickle down to your area?
May not be able to answer that. We got a couple of volunteers, but was it enough? No.
Okay.
But I'm very grateful. I promise you, I'm so grateful for the ones that we have and
Right.
had. We recently just got some. I saw. I was like, I'm off for 3 days, and all of a sudden, you have volunteer people. Um, I'm very grateful for these people leaving their families. Some people left their children to come down and help us because it was really bad. And so them having like seeing a new face, one, it helps spread to the rest of the country to realize how bad it is. And
Right.
two, any kind of help is appreciated right now.
Of course. Mm.
Any kind of like person that says I'm willing to work, for the most part, they work with you.
Back to symptomatology, there's just one question that was raised earlier. I wrote it down, but I forgot to ask. Did you see any differences in symptoms, like common characteristic symptoms amongst different populations of people? For
Hello?
example, I read somewhere that they said that African Americans, for example, were less symptomatic, but way more severe on presentation. So they weren't getting the characteristic symptoms. Did you find that to be true? Or like a lot of people come in more with like abdominal symptoms as opposed to your coughs and your respiratory symptoms? Hmm?
I think it also depends on, like, besides race, because we found out like the kind of proteins that you carry on your hemoglobin made a difference. People who had like, I read something about people who had like A blood type or B blood type versus O blood type were better because of the protein. Um,
Oh,
so many things that factor into this. People who
right,
people who were obese, they were definitely more sick. People who didn't eat healthy, they were definitely more sick.
right.
And so obviously you take your vitamins and you try to offset some of those things. But yeah, definitely in terms of I felt like our African American patients came in looking fine, and if hello,
You're
sorry,
back with us. Yes.
yeah, it was later, so they got sick, and it was later. So it all depended on
When you
what was,
present.
yeah, when you presented. Sometimes I felt like the Hispanic patients were much sicker when they were young with no comorbidities. I don't know if I've seen a lot of patients. I can't say that I can say from my personal experience
Mm.
what actually is taking place.
Okay.
So I can't like to answer that person in a nutshell. I think there are patterns. I think you need a bigger study to know the patterns of
Right.
which, how
And I
people
think we would need to collate all the data from like all the hospitals eventually. It may not be done
right now.
doing right now, like during the pandemic, where our aim is really to save lives. But at some point in time, you need to get like a census of like every single infected patient that we know of, break them down into like the different demographics of age, race, BMI, etc., and try to see if there's any commonalities that we can find or any trends. But for now, there's a whole wide range of symptoms. And if you do feel any sort of like malaise, or that's like a feeling of just not feeling well, or any sort of symptoms, it would be in your best interest to contact your doctor. Don't just run, but contact your doctor, go through the symptoms and see if it makes sense to come in for testing, or maybe it could be something completely different and you still would need to come in to the emergency room. And just remember, doctors are still working uh, beyond corona. It's not just corona. People are still pregnant, having babies. People are still getting other sicknesses. People still need, their general surgeons, and are coming into the emergency room for much other pathology, strokes, heart attacks. So we still want you to know that the hospitals are open for everything still, not elective things. So every emergency cases that you may have. And if you feel like you should go to the hospital and you feel less severe, you can contact your doctor to go through the symptoms and determine. But definitely, if you have severe symptoms, then you want to call emergency, what do you call it, EMS, and get yourself to the hospital if you're extremely severe with one symptom or the other. So that's just, please know the hospitals are still open to deal with patients who are corona negative but positive for something else.
Correct.
So how have you been feeling about the 7 p.m. appreciation? I see that like every afternoon, okay, clearly you enjoy it. Tell me about that.
At first, I was like, "What the hell?" So it started in Europe, and then a physician that I love and adore
Mhm.
was interviewed on. Her name is Dr. Sylvia D'Souza, and
Woo! Love her too.
she was interviewed on CNN, and they decided to bring that. And they talk about it with Chris Cuomo, and it became a thing. And it is amazing, like to see FIDNY, which is the fire department of New York, ambulances, now police officers. The one that I see every day is so large. Like I've had someone live 2 blocks away, and I can still hear it from that person's window. And
Oh,
yeah, so it's like loud, but there are days that, you're just like, wow. And there was a day that the Thunderbirds were flying over that
right.
day that Fidney and NYPD came to the job, and they brought food. And then later that night, it was just like a day where you just felt praised. And it brought me to tears. Like, wow, like for us, like really? And it's crazy
Mhm.
because people just always saw, physicians as people that made money, like almost like we didn't have feelings. Like you always came to work, you
Right.
always you always came to work, you worked, you weren't allowed to take a break, you're not allowed certain things, you're just superhuman. And then all of a sudden now you really feel superhuman, but the world's
Right.
finally appreciating you for that.
That must be a nice feeling. And I definitely think that one thing I have seen at this time, which was greatly appreciated, I think universally, is that you have seen an outpouring of love and community and, just people helping each other out. You see that there are some people that will go to their elderly neighbors and find out what do they need so they don't have to actually leave their houses. And in the hospitals, there are tons of donations right now with food, even people donating the masks that they may have. We have tons of companies that are actually sewing their masks, that are donating costumes. So anything that people can do to help at this time, people are really chipping in. So one thing is definitely the feeling of love and appreciation that I don't think we have necessarily felt so much before, but definitely it's good to feel appreciated at sometimes. And I could imagine too, as you said, on days when it's very low, when things, one disaster of another, one patient after another, just to feel that little boost in morale and in the spirits really would help you to continue your shift for the next 10, 12, 15 hours that you have. So I could imagine that being well appreciated. And as you mentioned earlier, you do have your moments where you make your little fun videos just to help lift the spirit of your team. So there are different things that people are doing, obviously, to lift the overall mood at this very deep, dark time for a lot of people. They're still good in most, if not everyone, and we're seeing that more and more the good being displayed. However, some
However,
people are still thinking that this is a hoax, that coronavirus is not real, and
hmm
that some sort of you know, conspiracy done by the government and or the medical field to frighten people into staying home. What do you have to say to that and to those people who may or may not be listening?
so we're talking about the people that feel like this is a conspiracy.
Yep, a hoax is not real. Corona does not exist.
Okay, it doesn't exist. So I mean, we just killed 10,000 people. We just killed 19,000 actually, almost 20,000 people. Yep, it doesn't exist. I mean, I don't know. I'm tired of probably I'm so tired of arguing. People tag you in posts and say, "Look what this person is saying," and it's just like
Right.
heartbreaking. Like, why aren't you believing this? But throughout all this humanity, there's always going to remain selfish people with self-interest, and people are just thinking it hasn't hit. But I promise, like I say to people all the time, I promise you, it hits different when it knocks in your backyard. When
Yeah,
you're watching your family member and people are thinking it's not just an African American thing. We're getting hit hard, but we're not 100% of the population that's being killed by the coronavirus. And so if you feel like it's a conspiracy theory, who am I to say anything? But I will tell you, my schooling has showed me enough that, it's not really a conspiracy thing. It's out of control. It's out of hand, and we haven't found a solution. But it's not something that's made up. It's just as real gets.
definitely. In terms of buying masks, do you recommend for the general public who has to go out? And as I said, states are going to be opening pretty soon, so you would need some sort of protection. Do you recommend, like somebody's asking, PM 2.5 filter better than the cloth
How
filter?
come I can't
Do you,
see? I can't even see all the things anymore. I
oh
can't
no,
see any of the questions.
I have questions on the
Oh
Instagram,
yes,
but I also have questions popping up outside of it.
look at
Yes,
you. It's like people. So the P, what is it? The P. So like there's the
PM
K.
2.5.
Okay, so different masks, different things. So one of the topics that was I think we talked about earlier, but we didn't delve into. There's like K95 mask, and then there's N95 mask. There's the 3M N95 mask. There's the P100. Some people use like in the ICUs use the scuba equipment and just add filters onto it. Do I recommend for the general population? I mean, do you know what you're using? Like it's very different, right? And um, I feel like everyone should have a surgical mask on, and those are pretty cheap. Should have a surgical mask on at minimum. Make sure it fits properly. um, if you need anything more, which I can't imagine unless you're working somewhere with a high volume of people, then you would need to be fit tested and get a N95 mask. But
Right.
otherwise, I would say, just for the general population, keep washing your hands. You get a nice fitted mask, and that's it. We talked about, putting like the cloth mask over it, and that works too, as long as you have the one that's properly used for the situation underneath it.
And then also knowing how to remove
How
is
to
just as
doff,
important as
putting it
wearing.
on. Yep.
So
You
just
do
bear
all
that
that,
in mind.
right. You do all that hard work for 12 hours just to touch it and then contaminate yourself. And the hardest
Exactly.
part is your face. Like if
Right.
you see this person that moved in on my face, like I don't get pimples unless it's like the mask, wearing the mask on my face, and then they get greasy and they block up your pores, and so you get bumps on your face, and so
Mhm.
that's a hard part.
And N95, somebody's making this point, N95 aren't designed to be worn for long periods of time.
Nope.
And that is true. I mean, because we don't really have something designed for such a pandemic, such an outbreak. But it's I guess, the best solution that we have right now. And if you do have the opportunity during the day, if you're wearing an N95, you're like your hospital worker and you have an opportunity to be isolated away from everyone and you can, safely remove your mask and actually, breathe. um, but realistically, with the amount of patients, you may not have that amount of time regularly.
Yeah,
So,
it's just one of those things, right? You don't have it, right? You take it off, but you initially, like healthcare workers, anyone can tell you, I don't know, when the N95, I was getting like terrible headaches, but
yeah, we're
yeah,
breathing all that
that's
carbon dioxide.
but my body's working the way it's supposed to, right? I'm breathing in my own CO2. It's supposed to say, hey, what's going on? Like,
Yeah.
can we get some fresh air? And then you start getting the headaches. And so it's not an abnormal feeling to have those things. But they're not designed for everyone to wear them all day long. But unfortunately, that is our lifestyle for right now. So you just have to get used to it until the solution comes and gets us out of the situation.
Yep. And then remember, if you're not really fitted for the N95, it may not be as effective as you think. Uh, Generally, in the hospital that Dr. Adebayo works at, they fit test that mask every year, at least once a year. I remember having to go through it myself. You don the big hood, you put on the mask that you think is of the size, and as she mentioned earlier, there's a spray that you can taste. And if you taste the spray, the mask doesn't fit because nothing is supposed to come through. And then you have to like rinse your mouth, do it again until you don't taste the spray. And then a second spray comes that it's a little, it burns. The first spray is like sugary, sweet, and the second spray burns. You're not supposed to feel anything if the mask is fitting well. Because a lot of times a regular mask may prevent you from getting certain smells. It doesn't mean that it's really blocking out, very small particles. So the N95 is in an ideal circumstance a mask that's supposed to be fit tested. Is everyone being fit tested for masks now? Probably not. And with the hospital supply, are you wearing your right size? Maybe not either. You may not be able to have the luxury to say, I'm a small, medium, large. I don't remember what the sizes come in. But the point is, as much as possible, if you can fit test and get your actual mask, that's good, but it's not always possible.
Nope.
One question is, have you been able to take any vacation days, or has there been guilt if you decide to take a day off?
I was given vacation, but I was at the hospital all the time. We came in and we would run around with the iPads and speak to patients and their family members, have them call their family members and let them see them.
Oh, that's what you did on vacation?
Yeah, came into
Oh,
work. So it's very different, some places made people took away all vacation. Some places, said that you have to because we can't afford to pay you out. So it's very
hmm.
different. I wasn't forced to come to work. I was able to take my vacations, but I chose not to.
You chose to. Okay. That's nice. Very good. Very nice of you.
Mm-hmm.
So, if anyone has any okay, what do you guys, we talked about this before, but just retouch because I see this question actually multiple times. What are you doing for mental health and self-care?
So there's like a COVID network you can tune in for. I didn't mention a couple of things actually. So the therapy, they have a physician or healthcare worker COVID network for like healthcare, for mental health specialists, so you can talk out. And I found that it was very helpful for me, which in the world of being African American, we don't talk to shrinks, we don't talk to therapists, but I think that's a huge problem. And so I started talking to one. We do a lot of dance videos, listening to music. There's also yoga online that I started because I feel like just being at work and not active is affecting me as well. And I guess religion to some extent. I mean, churches are closed. And so you have to find the spiritual aspect. And I can truly say that every day I'm so grateful to be alive and well, and not to have to worry about a family member being sick at this point in time, or, because the emotions are way different. As much as, you want to think like you're a doctor, it's very hard to be sympathetic and objective. And so I'm truly grateful for those things. In like 2 years, 3 years, I think there'll be more psychiatrists than any other specialty, because so many
Needed.
people are traumatized.
Needed.
Right? And that's going to be key, because right now people are not showing that aspect of them. And then later on that, it will be a problem.
Right.
It's definitely going to be a problem. So that's what I'm doing right now.
For me, I actually delved into painting. I do a
Oh,
lot. I love painting. I hadn't painted for like about 2 years. And then I started, started painting, back into makeup and actually doing Instagram live series, which, you're currently tuned into, because I think that, one of my purpose that I can be useful right now is not just, doing what I do, but also educating people about different things. I am an obstetrician and gynecologist, but I try to like make it a holistic approach, because we're not just one aspect or the other, we're a whole. So anything, just remember too that you're socially isolated physically. It doesn't have to be mentally. So you can call your friends. There's tons of apps for video conferencing: Zoom, Google Hangouts, WhatsApp video, FaceTime, just to name a few. Uh, so you don't have to like be emotionally apart, though you're physically apart. My family, we actually play games on Zoom almost every night. So there's an app called
oh, that's
Steam
cool.
that you can screen share, and we play games. Yeah, like up for hours every single night. And I have family in Trinidad, a sister in Colorado, a sister in the British Virgin Islands, a cousin in Bahamas, and we're all tuned in on Zoom playing this game called
That's pretty
Fibbage.
dope.
So,
That's pretty dope, actually. You have to send
yep,
me that information, because that's
I
definitely something I would love to take advantage of.
definitely will. It's very fun. So I think we're gonna wrap up this. I know Instagram is probably gonna count me down. We're like
I was
5 minutes.
I was looking at the time. I was like, uh-oh, they're about to cut us. Oh,
So I want you to know if you have anything to tell to the viewing public. What advice do you have to give to the public generally?
the general advice would be, this is just not, you have to just be patient. This is not one of those things where I can predict, as I said, the world is canceled right now. And
Right.
so, treat it accordingly. All those sci-fi movies that we watch, we're actually living that truth right now. So I wouldn't be so quick to run out to make money, because you're risking your life, and no money can be made from the grave. That one I can
Right.
assure you. So, check on your neighbors, find out, if they're okay. Um, the old principles about being your brother's keeper should apply, or being your sister's keeper. Continue with the humane side of things. You meet people, they just say, oh my God, I'm so proud of you because you're a physician or whatever. And I think that's amazing. Some people don't know what you do and they tell you they're proud of you. But, live in the moment. And that's what I would say. Wash your hands as frequently as possible. Get some hand
Watch those
sanitizer.
hands.
Wash those hands. Get some good old fashioned Dettol. My cousin sent me some. That was amazing. Fabuloso, bleach, Lysol wipes. People are like, oh my God, we don't have Lysol wipes. I'm like, we never used to, like, we improvise, right? So those are the things. And, try, speak to people that know things. Dr. Jackman is obviously more educated about things that a lot of people have read. She's not in emergency, but she still is, and it just takes getting your information from credible sources, and she's a very credible source. So you always have those options. You can always send me questions to Instagram as well. But I definitely appreciate the one thing about COVID, that when people say, they always tell you the things you hate the most, the one thing I do love is the camaraderie and the humanity of patients and people around the world. And we hadn't seen that in years, and it helped to reset everything.
That is true. That's one really good thing. That is true. So we want to thank everyone for joining us here today, and listening to our little Corona on the front lines through the eyes of Dr. Adebanke Adebayo, an emergency room physician working in New York City during this pandemic. I want to personally thank my very good friend, Dr. Adebayo, for taking time from her busy schedule to actually join us and educate us on the experience and give us some helpful tips that we can use going forward. And, just this first-hand account of coronavirus that most of us may not have been exposed to at all. So thank you, Ade. That is
You're
all for today,
welcome, Dr.
everyone.
Jackman.
Thank you, everyone. Let me just go through the list and see what names I can recognize. Thank you, Liana. Thank you, Smeebs 80. Thank you,
Oh,
Davey.
there's a lot
Smeebs.
of, you don't know the names. So, like, I saw so many names. I'm like, do I shout them out or not?
Shout them out.
But
Now is your time. We haven't got any
so
countdown as yet.
Marissa, Christina, I definitely saw you. Kafila, I saw you. I saw one of my friends who's a critical care doctor. He was on earlier.
Bless up Lioness, Queen
Yeah.
Bee,
So who's?
Father Highness, Michelle
Oh,
Gomes,
yeah, Father
Dr.
Barber.
Bynum.
That's one of my friends. He's like, now he works in a hospital. So very much thank you everyone for your support.
Child of Wealth. Sorry for
Yeah,
killing your
that's my
name.
cousins. They're definitely my cousins. So definitely, appreciate you
Danielle,
guys.
Linda.
Yeah,
My
definitely
mom and my
appreciate
dad, I see them.
it.
They actually join social media so that they can watch my
Oh, that's so
Instagram.
cute. My mother is just all over social media. Let's not talk about that.
Both of my parents recently got an account.
No, my mother's page is popping. So thank you
Maria,
everyone for your support. I'll
thank you,
definitely
thank
send people
you.
messages. Look through it over as we read it, and definitely send people messages and tell them thank you. Appreciate
And
it.
we will put the link that Dr. Adebayo is going to provide us with for the therapist. If you think that you need to speak to someone, is it available? It's available for New York for any specialty, or is it specific
I think it
for
was
medical?
any specialty.
Any specialty. So if you live in the New York area and you're watching this and you feel like you can benefit from talking to someone during this time, you're going through your own things, and it doesn't even have to necessarily 100% be corona related. You just need to speak to someone at this time. It's a good resource to reach out to, and we will provide that link later on. Thank you once again, everybody, for joining. Thank you, Dr. Adebayo, once again. That is it for today's session, everyone. We will be back tomorrow at 8 p.m. for a pre-Mother's Day makeup glam tutorial. So anybody who likes makeup, I'm not doing it. I'm not going to be the one hosting it. It will be makeup from Makeup by Megan. And we're also going to be discussing Corona's effect on pregnancy. Megan is actually pregnant, and we're going to go through that, Corona and pregnancy. So that's all for today. Stay tuned, and we'll be back tomorrow. Bye-bye, and thank you.
Thank you. Bye.